Just wish we weren't so dark. That look different on their computer, actually.
Hi, Andrea. Nice to see you. Oh, she's gone. Good morning. We're just waiting for people to join. We're expected about 10, so we'll just give a couple of minutes whilst people hopefully sort out the IT. I'll just give it a couple more minutes. I'll make a start. I'll make a start because I'm just doing the introduction, so hopefully more people will join as the seminar goes on. So good morning and thank you for joining us this morning. We're really delighted to have you with us. We've got an exciting agenda looking at the annual quality accounts and also looking from a point of view of moisture damage in relation to tissue viability. Please feel free to comment on any topics. We've got the chat and there's also Q&As, but we are absolutely going to allow you to use your mic, so verbal conversations would be really highly appreciated, but any feedback, whether you like it or don't like it in relation to the emojis, feel free to use them, and we'll get started and just see how we go. So I will hand over to Cinda in relation to the annual quality account, and she's going to present the work that we're doing, and I'd just ask your opinions on some key aspects of that to make sure that we've got that real patient involvement in relation to what we're planning to do going forward. So I'll hand over to you, Cindy. Thank you very much.
Thank you. Good morning, everybody. My name's Cindy, or Lucinda Cumpston, and I'm the Quality Assurance Manager for Nottingham CityCare Partnership. Sue's kindly doing my slides for me. We've got some Mentimeter questions during this presentation as well, so we'll explain how to use Mentimeter as we go along. I think probably next slide, please, Sue. Just to reflect on our mission and our vision in the organisation, because that's obviously a strong theme throughout the organisation, our plans and also our annual quality account. So our vision about driving excellence in neighbourhood health, and our mission of making a difference every day to the health and well-being of our communities. Next slide, please. And within that, our strategic ambition, with the care we deliver to the people living in our communities, to be at the centre of everything we do, with our 4 strategic ambitions to focus on our care so that we're safe, effective, it's high quality person-centred care, our people, so it's a great place to work, grow and succeed, our organisation, building a strong foundation to ensure long-term organisational success, that we continue to grow and develop, and also the importance of our community and our partners to improve neighbourhood population health outcomes. So that's just as a backdrop to the presentation. And also, next slide please, Sue, just our values and behaviours. Kindness, respect, trust and honesty as our values, and our behaviours, inclusive, accountable, courageous even, and one team. Next slide, please. So the annual quality account, it's produced by organisations delivering NHS-funded healthcare, and the intention is to highlight the quality of services we provide. So the focus is on where we're performing well as those requiring improvement, and this originated from Darcy back in 2008 about having that public accountability for the quality of services an organisation is providing. And also the account looks at previously agreed quality priorities alongside new priorities for the coming year, and how patients, the public, carers and our staff have been involved in shaping those priorities. Next slide, please. So looking ahead, as I've said, it highlights our accountability to our patients, our carers, our stakeholders, while also reinforcing our commitment to improvement and compassionate care, and our commitment and dedication to reducing health inequalities and embedding inclusivity into all our aspects of work. So the Health Inequalities Example conference was a great opportunity to share insights and spark collaborative action with teams and our partners. So next slide, please, Sue. And this is where we're going to just get some feedback from you on our and start helping thinking about some of the conversation or questions that you might want to ask around the annual quality account. So the first question, and I'll share Mentimeter in a moment, is around what you think what quality in CityCare services means to you. What sort of words come to mind? So you've got between 1 and 3 words. So just to give you some examples, people might say it's safe care, that the patient's voice is heard, that it's about audit, it's about ensuring we're clinically effective. So I'm just going to share Mentimeter, and then we'll be able to see what people's thoughts are. Mentimeter takes a minute or two to catch up. And I meant to start at the beginning by apologising if you can hear some background noise. I'm in an open plan office, so you might hear some noise. Okay, so it's the kind of words that we would expect to see in relation to quality, so that we're providing safe care. And I think that's a really important one for anyone under healthcare services, that it's person-centred. So we're thinking about the person and their individual needs, that we care about our patients, and that we're part of the community that we serve. So again, that's a really important aspect within our quality, and that we've got competent and professional staff providing care. So I think that just helps to start to think about what we expect when we're looking at a quality account, and how that's reflected through our priorities. I'm just going to leave that open for another 30 seconds if anybody else has got anything they want to add in. Okay, lovely. And we'll go back to the slides. Please, Sue. So thinking about our proposed quality priorities for this forthcoming year, what we've done is actually looked at our quality priorities and how they're aligned to our following key documents that we use within the organisation. So the well-led review in 2024, so how well we lead our services within CityCare, our CQC improvement plan 26-27, and that's how we're continuing to develop as an organisation, carrying on embedding quality within everything we do. Our clinical and quality strategy that's been released a couple of months ago, our 5-year strategy, our business plan metrics, and our patient safety incident response plan. So that's about our focus around patient safety and where our priorities lie over the next 3 years. If I could have the next slide, please. So as part of that input, we're consulting with staff, stakeholders, patients, to look about our quality priorities that we've pulled out from looking at these documents, and asking everyone to give their views on which of the 3 of the 6 quality priorities you would like to be included in our annual quality account. Once we agree those priorities, we will develop SMART objectives, and there'll be a priority lead who will take that forward for the next 12 months. Next slide, please. So again, just before we start to move into the quality priorities one by one, I've got a Mentimeter question that you can select answers from, so that again we can start to focus in on what we're thinking about when we're talking about priorities. So I'm just going to share my screen again and move to the next slide. So when something goes wrong with care, what matters most to you and your family? So you can indicate on there whether you disagree with the statement or you strongly agree with it, and where that sits. So anybody that wishes to add into that, please do so. So when something goes wrong, what's most important to you and your family? So what we're thinking about there is, you know, sometimes if somebody's had a wrong medication, if they should have had a visit and they didn't have a visit. Okay. So again, thinking about things that go wrong, it's about that openness and honesty when something's happened, so that the patient and family, if they consented to their involvement, are involved in, well, actually, let's look at what's gone wrong and what we need to do to ensure that it doesn't happen again, having that apology, and support for families and the patient after an incident. And I think that's reflected in sorry, I haven't shared, have I? The responses we're seeing there, that these are all really important areas. So we can go back to slides. Sorry, it's a bit jumpy back and forward. Our first proposed quality priority is around first time incident response and learning. So the focus for us, if we choose this particular quality priority, is strengthening the quality, timeliness and impact of patient safety investigations, ensuring consistent learning and effective organisational dissemination in line with PSEF principles. So what does that mean? It means, again, from a quality perspective, ensuring where we've got patient safety incidents, where a patient suffered harm, so that could be a medication error, it could be a missed appointment, it could be the wrong care provided, that we're making sure that we have that initial direct contact with family and the patient, that we're open and transparent, and our focus is on learning and making sure that we do our best to make sure we don't have any further incidents like that going forward. So it links directly to our business plan. It links to our PSEF audit, our quality governance and our strategic ambition. In terms of our CityCare documents, specifically the clinical and quality strategy, because that's quality is the organising principle, and obviously it's important to embed your safety governance and the well-led review. So if anybody's got any comments that they want to put in the chat as they go along in relation to each of the quality priorities, please do so. But what I've got at the end is a request whereby I'll ask you to rank your quality priority preferences on an individual basis, so that we're taking the Share Forum's feedback in what they feel that the priorities should be for CityCare going forward for the next 12 months. Okay, I'll just pause there in case anybody's got any questions that they want to ask. Okay, I'm going to share the next Mentimeter question. So the next one is, what matters to you when CityCare is following up on your care? So is the most important thing when you're receiving care is knowing how and when you're going to be contacted, clear information, being confident I won't be missed or forgotten, and care feeling joined up even when more than one service is involved. So it's about that patient input to their care and really feeling part of that pathway of care. So you're very clear about what's happening, when it's happening and how it's happening, and feeling fully involved in that care process. And of course, importantly, if things change or worsen, that you're clear what you need to do, who you need to contact, how you need to access further help. And again, that's going to shape thinking about our next quality priority. So if you bear those in mind when we move to the next one. know, at the moment, the strong one is knowing how and when I'll be contacted next. And I think that's really important in healthcare, that our patients, and we are also patients, know what's happening. What's the expectation? Okay, thank you. So I'll stop sharing if we go back to the next one. So we'll look at quality priority 2 as an option. So priority 2 is zero missed follow-up, safe caseload and patient contact systems. So that feeds into what we're saying about what matters to our patients in terms of following up on your care. So ensuring that we've got reliable follow-up systems. So that's use of digital systems, system 1, which is the patient safety record, having clear next contact due arrangements and reduction of loss to follow-up risk. So again, how that feeds in with our business plan metrics, our well-led review, and our quality committee having oversight of our patient safety, incident investigations and following up learning, so that if things go wrong, that we've got clear processes put in place to make sure that that doesn't happen again, and how we provide assurance to our quality committee and to our board about the actions that we've taken. So I don't know if anybody's got any questions there. Again, you could put questions in the chat, or please feel free to raise your hand, or indeed contact me afterwards if you have some thoughts post-event. Okay, next slide, please. So thinking about quality priority number 3. So thinking about safety, so thinking about safety in your care and your family's care, what feels most important to protect people from avoidable harm? So that's things like preventing a fall, preventing a pressure ulcer occurring when somebody's under our service, clear advice on how you can keep yourself safe at home, that being relayed to any of your carers, family members, and feeling confident that safety concerns are taken seriously. So again, if you'd like to respond to that, or you can respond within the chat or using emojis.
Do you just want one answer for that one?
I think you can pick more than one answer.
Okay, thank you.
Sarah, have you got your hand up?
It only lets you choose one.
Okay, so it is only one. Okay. And I think that does reflect the feedback that we get, and also on talking to patients, families and carers about, you know, what you can do to help keep yourself safe. And that includes how you access advice and support should you need to through your care event. So thank you for that.
Be all of them, couldn't it?
It could.
Yeah,
Making you work quite hard, really.
No, interestingly enough, we weren't the one who put pressure.
Sorry, were you saying something there, Sarah? No.
I said, interestingly enough, for those who don't know, we're the team that prevents pressure ulcers. We didn't put that, in case you're thinking, oh, they will have put them on. We didn't.
Yeah. Absolutely. And that leads nicely into our third quality priority, which is the harm reduction bundle relating to pressure ulcers, falls and medicine safety. So the focus in this priority would be or is around reducing avoidable harm in the highest frequency and highest impact incident categories. So again, that aligns to our business plan metrics, our quality dashboard reporting to the quality committee. We have plans in place for our pressure ulcers, medicines, safety and falls. So it's about building on those foundations to, again, be really focusing about how we can avoid harm. And obviously that relates again as well to evidence-based practice. So any questions on that one? Okay, so I'll go to share to go to the next slide. Which is, and this one is around a more focused piece of work around diabetes care. As we know, that's an important issue within our community. So what would help people get better diabetes care? And again, that's just one choice, please. Okay. Yeah. And I think that reflects what I would anticipate to see, that there's a lot of support earlier before problems get worse, and how we can support that support patients with diabetes with management and early identification of problems, plus supporting and understanding different needs from different patients with different issues relating to their diabetes. So if we could come back to slides, please. So priority 4 would be equity and access and outcomes, having diabetes as a focus year. So reducing inequalities in access, uptake, completion and outcomes with an initial focus on diabetes care. So that directly supports commitment to health inequality, strengthening population health management and expanding outcome measures. And that specifically links to our 5-year strategy about our neighbourhood health, equity and prevention, and our clinical and quality strategy about co-production and outcome-focused improvement. So that was, or is, our proposed priority in relation to diabetes. Any questions or comments? Anything coming through on the chat? So just in case I don't miss anything.
Not that I've seen, Cindy.
Okay.
Anything in the Q&A? I think the Mentimeters are good questions, aren't they, for getting people thinking, etc.
And then next slide, please. So quality 5 is around digital transformation. So this is looking at our digital records. So looking at how we continue to develop those, improving access to information for clinicians, access to information also for our patients, so that again it helps with the journey of care, so that what we've got in all our records across health is integrated records, that we have the right information at in the right place at the right time for that patient consultation. So for children's services, it's about involving multiple professionals and agencies, And it also links to our clinical quality strategy, having joined up care about better information sharing across care settings. And that links to not having to tell your story several times over on your health journey. That we work within health to ensure that we support that journey through. So I've now got another Mentimeter question for you. Oops, let's go to that one. I've missed one. What would help children and vulnerable people to stay healthier? Just share that slide, sorry. So again, it's how, whether you disagree or strongly agree. So for vulnerable people, so that could be people that have a disability, that perhaps are homeless. So again, it's around what you feel are the key areas that we need to look at. And again, there's a strong focus on all of those, that, you know, we're helping people, providing that extra help where people are more vulnerable. So again, that kind of links into the digital. Not everybody uses digital services or feels as confident. So it's about how we support people when we're developing our systems and processes, getting help earlier before things get worse. I think that's a theme throughout. Quality and services working better around the whole family. So the patient and their family are fully aware and feel supported through that journey with their particular health condition. So thank you for that. Next question, please. Oh, hang on, sorry, I didn't share, did I? You know what it is?
I'm say, did you want to share the slides?
Yeah, do you know what I keep thinking I'm going to do is end event. So I'm being very careful where I'm clicking on to. So sorry. So the two strongest ones there are getting help earlier and services working better around the whole family. And I think that's really important because our families are our eyes and our ears. So if a patient that we're visiting has any sort of change, it might be very subtle changes, but it's really important that family are offered the opportunity to be included in that pathway of care and can contribute and give us those early indications that symptoms may be changing, not necessarily getting worse, but changing. And then moving on to our sixth and final priority, which is about improving population health outcomes. So that early identification and targeted intervention with a particular focus on children, families and vulnerable groups. So again, that focus about preventing problems early, services designed together with patients and carers. Okay, so coming to the final Mentimeter question. It is about ranking which of these priorities you would see as being the most important for us within CityCare, and what would you see as the least important out of those? That doesn't mean we won't be taking those priorities forward in a different way through our business and quality, but they may not necessarily be part of the quality account for this year. So if you would like to, I'll just put them up. Look at which ones you would rate. Fabulous. That's great. So it's a very strong focus on improving population health outcomes. So that's fantastic. So thank you all for participating in that and giving you feedback. As I say, I'm more than happy if anybody's got any questions that they'd like to ask around the annual quality account, or please feel free to contact me. There are rather my contact details, which I think Sue's going to put up on the last slide. If anybody wishes to contact me at any point. Our annual quality account is actually published by the end of June each year, so we are on a time scale with our priorities. So once we've taken in feedback from staff, stakeholders, patients and carers, then we take our proposal through our governance structure for that final alignment and decision around which 3 of those 6 priorities we'll be focusing on over the next 12 months. So thank you all very much.
Thank you.
Thanks for that, and thanks for everyone's feedback. It's really appreciated. It certainly gives us a clear focus going forward. I think the next one to come up is Sarah now with the moisture damage. So I'll hand over to Sarah. Thank you very much.
Hello everyone, I'm Sarah Pankhurst and I'm head of the Tissue Viability team, which is a bit of a complicated title, but really we're wound care and skin care. And I'm with my colleagues Alison Parnham and Helen Cutts. We're just aware we're quite dark on the screen, so you can't see our faces properly. But if we go to the next slide, I'll tell you what we've come to talk about, which is skin that's been damaged by moisture, which we call moisture related skin damage, or moisture associated skin damage is MESD is the quick term we use. So we're a team that look at skin and wounds, predominantly wounds really, but really all about wound prevention. So when you saw pressure ulcer prevention on Cindy's slides, that's our team are leading that for CityCare and educating all of CityCare staff around these issues. So we give advice. We're a specialist service of specially trained nurses who give advice on all types of wounds and skin conditions. We've got lots of experience working in hospital and the community and with GP services and care homes, and anyone who's in the city who has a registered city GP can be seen by our service. But today we've come to talk about moisture damage on the skin, and that's any area of the body really, any type of moisture that is causing damage on the skin, but it is usually incontinence related. That's the most common that you would see, and would also nappy rash would be under that. Any sort of person who's incontinence and isn't having their continence managed might get moisture related damage. And one of the big reasons that we're interested in this in particular is not just for comfort of people, because obviously very sore and painful if that happens to you, but it does increase the risk of pressure ulcers, which you may know as being called bed sores. But we don't call them bed sores anymore because they don't just happen in a bed and people in chairs. It's people who don't move are at risk of pressure ulcers. So we're looking at some things that we've developed around moisture related skin damage, and we're just leaving these questions open so that anybody can put their hand up and ask about it or put any questions in the chat that they want to answer. So one of the things we're thinking about is, do you think people know about preventing moisture damage? I won't use the word MESD, just moisture damage. Do you think people know how to prevent it? A lot of you will have had children, or you might have been caring for somebody elderly, or you could have had problems yourself, looking at how to prevent that happening. And do you think enough is known about preventing moisture, skin damage? Feel free to chip in or type anything. So the other thing we're thinking about is, do you think people know how to recognise it? So if somebody had something wrong with their skin, would you know, or would people, you know, in the generally out there know how to recognise it and how to know that that's the problem that's causing it in relation to any other sort of problem? Yeah, Cindy. Oh, I've got Cindy and Sue. Yeah.
I was just going to say about the impact of different times of the year, like when it's particularly hot.
Mhm.
How does that impact
Yeah.
moisture damage?
Yeah. Somebody's put in the chat they don't think it's a well-known issue. So yes, although we've said it's usually incontinence, that's the most common sort, it also can happen through sweating, it can happen through dribbling. You know, with people with chin sores and neck sometimes. It can happen around wounds. So it can be on the legs, and if you've got weeping wet legs, for example, you might have heart failure and swollen legs. That can cause moisture damage, and it can collect under the heel. So if you think around a wound, the easiest way for us to describe it is when you've been in the bath and your fingers go crinkly, you can get that appearance on skin that's been exposed to too much moisture and over wet.
Or that colour change.
Yeah. And so it can go white and soggy. That's what happens sometimes around wounds and on legs.
And it can be risk of infection.
Yeah, it increases your risk of infection. So on top of it being incontinence, there's a lot of other reasons that can cause skin problems. Yes, Sue?
I was just going to say, linked to that comment in the chat about it not being a well-known issue, I think it's about how people recognise it, isn't it? So what they might think is an early sort of issue, and how they recognise and get the information to support them to prevent it from deteriorating any further. It's that, you know, we talk about prevention a lot, don't we, and understanding how it happens is, but when it starts to happen, it's that recognising that if we don't get the right treatment for it, it might go on and become worse.
Yeah. So a real thing that we deal with in our work every day is pressure ulcers and looking at preventing pressure ulcers. And because this causes increased risk of your skin breaking down to pressure if it's wet, and that really can turn into quite a nasty wound. And, you know, worst case scenario, they can go right down deep as bone, and this increases the risk of them. So that's one of the reasons why, you know, we want it preventing, because as you'll see from Cindy's slides, pressure ulcers are one of our harms that happen to people. So we want to keep people safe by preventing those and prevent the complication to their life if they should get a pressure ulcer. So one of our offers to you is if you would like us to come back and speak to you about pressure ulcers as well. But we've come here to talk about the things that will increase the risk when we've got this moisture related skin damage as the starter sometimes. So that's if we'd like to get information about both of these things out there and more widely known in the population. Emma, yeah.
I was just going to ask, so obviously when you guys get involved, there is already damage, and I'm just thinking about, just thinking from a personal perspective and caring for family, do other teams share information about this? Because I'm just thinking, you know, like palliative care, rehab team, when people are, you know, not as mobile, is information shared about skin damage then? Because I'm not sure my mother-in-law knows about it, and
well, it depends who's involved in your care. If you've got CityCare involved, so everybody in CityCare and its policy gets a pressure ulcer risk assessment, and in that is continence and skin and wetness and skin damage. and then patient, if they are at risk, gets a leaflet and a plan of how they're going to prevent their pressure ulcers.
Okay.
The issue might be if they're not at risk at that point, then they wouldn't get that information. So
it's about trying to encourage, you know, to maintain that mobility,
Yeah.
isn't it? To prevent that. So
yes,
having that conversation, you know, by
Yeah.
doing this, you will prevent this.
Yeah.
Yeah.
So those conversations are, there's lots of resources in CityCare for those to be used for everyone. We've got information plans, and every pressure ulcer that develops, we go back and we have a look how it started. So if it started with moisture related skin damage, we would pick that up to prevent it. But what we have done as part of one of our actions was we are telling all the staff during our teaching that if people have moisture skin damage, you've got to treat it as a pressure ulcer and get pressure relieving equipment in and start early, start before they then get the pressure as well. Yes, Sue?
So just linked to what Emma's said. So I think what you've said is if you're receiving services from, say, like CityCare or a community service, those, what about those people? How well do you think it's known in for those people that don't have that input, that potentially just maybe have a care package from the local authority? You know, have you got any sort of ideas or work that you're doing in relation to how you raise that awareness across that group of people that haven't got a professional nurse or team going in to see them?
It's really important, because one of the big things about people might know, and Alison and Helen will talk to you about it in a minute, about the things you can use to prevent the moisture damage. But that going on to develop a pressure ulcer, that is a surprise to people, and it's still a surprise to people now. It just isn't. And the Tissue Viability Society, there's National Society and guidance, and it's still getting that message, particularly over people who have a disability or have been immobile for a long time, and then they start, they get older, their risks become higher, and if they've never had a pressure ulcer before and they get a deep one, it shocks them how long it takes to heal, how it happened in the first place, how it occurred. Because a lot of the time you can't feel it happening if you've got a disability or any sort of sensory loss in your body. You don't feel it, and you want to carry on with your life as much as you can. And so, it's difficult. We've got to do things like get it worked into people's routine so they can have pressure relief. For example, people might go on holiday and not have their usual environment, things around them, and then that's sometimes when they get a pressure ulcer because they're in a different environment. It is definitely something we'd want to talk about and get across to people to know more about this subject.
I think a lot of care agencies are quite good and better now at looking at the different products as well, about like barrier for moisture damage and things like that.
And we work
care agencies.
Yeah, we work with carers. If we're involved in the patient care, we would also be working with the carers.
Anybody like to say anything else? No. Next slide, please. So I'm going to let Helen and Alison have developed a leaflet. I'm just going to swap places so they can talk to you more directly.
Okay, thanks, Sarah. Morning, everybody. I've been listening intently, and it's all very interesting. So Helen and I developed an information leaflet for recognising and preventing and recognising moisture damage, really to raise awareness to the general public, to patients, to carers, about what it is, what other risks could be associated with it, and really how to prevent it and what products are available. And there are lots of products available on the market, but that can be quite confusing to somebody walking into a chemist and wondering what's the right product for my member of the family. And so it's really to raise awareness about that as well. Oops, next slide.
Warn them of the pictures.
Oh, sorry, yes, I do need to, before we move any further, just to warn you, there are some pictures of different types of moisture damage. So if you don't want to,
maybe not on this one, it might be the next page.
There's 4 slides in total, so I think it's possibly the 3rd slide that moves into this is how severe it can be. So just as a pre-warning, if you want to look away at that point, that's absolutely fine. So this is the information leaflet. There is a link to getting in touch with CityCare for further information, and the leaflet is also available on request in different languages. Okay, and the guide is specifically targeting patients and carers, so it's been written to them, for them, to raise that awareness. So just dip in when you want, Helen.
Yes.
Next slide, please. So the information is to help understand what moisture-associated damage is, how it can affect you as the patient, who is at risk, and other risk factors, the areas of the body that are most at risk. So it's not just thinking about urinary incontinence. It's not necessarily just the bottom that is associated with moisture damage. It can be other parts of the body, and we'll go. This leaflet highlights that as well. It talks about what is moisture damage, which Sarah's already led into this, but it's continued exposure to moisture causing overhydration of the skin, so it makes it that white soggy tissue, which is at greater risk of infection. So it can cause soggy skin, redness, soreness, and even blistering. The skin surface can be broken once those blisters burst, and it can have the appearance of a rash or something called dermatitis. It can look red, inflamed. It can feel itchy. And it's also important to think about different skin tones for patients. So for patients with darker skin tones, early moisture damage might be seen as purple. Red is a difficult colour to see in darker skin tones. So it might be darker in comparison to the patient's skin tone. It might have a purple hue. So there's quite a lot of variation there that you might want to be looking for at that beginning of damage.
I was just going to say, I think that goes back, to the introduction, like, I think it was on Sarah's second one about how you can how to recognise MASD or moisture damage in different, like darker skin tones. Yeah. Different skin tones.
So it's kind of being vigilant as a carer in doing that skin assessment. Sorry,
there's a comment in the chat. Someone's asking how can they get hold of the leaflets?
Yeah, the leaflets are at the final stage of being printed. And then we're going to look at how we can distribute them, but they certainly will be accessible via CityCare.
We can email this though.
We could email this. This is set up as a PowerPoint, but once you print it, it turns into a leaflet. So the order that you're seeing is slightly out of sync because it's on a PowerPoint, but we could certainly give you printed copies of the leaflet. We can print them out and send them, or send this PowerPoint. But we are also looking at getting printed copies so that we can, I don't know, we haven't talked any further about can we put them into some of the CityCare GP practices to raise awareness that way. Might be something
or clinics, like
clinics. Yes, different clinics within CityCare.
And I think you're saying maybe the continence service as well.
They've got, they will have access to it. It's literally it's hot off the press. This document also talks about products that we would use within CityCare that are on prescription, so they wouldn't necessarily be off the shelf. So we look at there's barrier creams, which actually is on the next slide, as a first line protecting the skin. They are barrier creams that don't interfere with the absorbency of the pad. So rather than something like Sudocrem, it would be more silicone-based barrier creams, which are the products that you can see. There are also cleansers available on prescription and thicker ointments, which creates a stronger barrier. And
those ones now are a bit easier to get as well. Is it the ointment and the cleanser?
On prescription.
I think they're a bit easier to get maybe from carers and speak to the doctor.
Yeah, Yeah, the GP would
or,
prescribe those.
or if they're under like a district nursing team, they can get
the
them
nurses would get them. Yeah. For an actual treatment, when the skin is broken, then we step up to a honey medicated wound gel called Revamil, but that would be something that the nurses would advise. Next slide, please. And then this is things that maybe you could do or the carer could do to look at reducing the risk of developing moisture damage. So looking at the skin daily, checking for those changes in skin colour or any areas that are blistered or broken, speaking to the GP maybe as first line, speaking to the carers. If nurses are involved, obviously speak to the nurses about what you've found. That's really, really important, is that communication between patients, carers and the nursing team. Cleaning skin is really important. Using the skin-friendly cleansing foam or wipes rather than strong soaps. Most soaps, particularly the soaps that smell nice, have got alcohol in them, and so they can be really quite drying, which could further create a problem on the skin.
I think a lot of people don't always know as well that you can use the emollients as a wash as well. I think when people have got the leg wounds, they're starting to learn that you can use the emollient as a leg wash, but that you can use emollients as a soap wash as well.
Substitute that's better for your skin.
Yeah.
So soap generally is very drying. And then this looks at how severe damage can be, with a slight reference to a kind of moisture damage meter, and it's really mild, moderate and severe. So on the mild side, it would be looking for those changes in skin colour, so some redness. Moderate moisture damage is where the skin is maybe beginning to blister, and then severe is where there is the top layer of skin has actually been lost, and that's obviously where there's much more increased pain, and we would step up to that treatment with honey. So severe moisture damage can also be in skin folds, where for patients who maybe have large aprons or skin folds maybe at the back of the neck, we certainly see that with babies, with the sort of puffy fat neck.
I guess, yeah,
obesity,
obese patients, getting folds.
Or contractures where the skin, where the arm is maybe bent from a stroke, where you've got skin to skin contact. And moisture buildup will occur with that skin to skin.
Like in one of the pictures as well, like stomas, patients with stomas, that's still obviously the skin around that can suffer from moisture damage as well.
From the fecal fluid with the stoma. And then picture 6 is the wetness from a wound. So the wound is already there, but it's leaking and it's leaked onto the surrounding skin. So it's really just to raise awareness about what can happen. So I know the pictures aren't the nicest things to look at, but I think it's important. I'll be interested to see what you think, but I think it's important to raise awareness of this is how severe it could get.
Just to say, all of our leaflets have QR codes on them, and so what we need to do is upload them to the CityCare website so that people can download them as well for QR code.
Yeah. And then share it, can't they?
Save
and
printing.
They could share it to each other. So I guess, like care agencies, they could always get the form and then share it to a lot of them, I think, have, like WhatsApp groups among each other as well. So they could put them on there.
Yeah, it's a good idea.
Like a team group. Yeah.
And last slide, please. So this is really just to show from the kind of whole body perspective, those areas to look for specifically related to moisture damage. So the back of the neck, maybe from saliva that Sarah mentioned, from dribbling, if there's excessive saliva production for some patients, in skin folds, in the groin region, around the stoma, in the lower limb, if there are ulcers that are leaking. So lots of areas, the axilla, from maybe excess sweating during a period of infection, for example. We saw an increase in moisture damage during COVID because of the patients with increased sweating when they were unwell. So there's some risk factors there on that last page, talking about obesity, urinary or fecal incontinence, but also patients' level of mobility that might affect them being able to get to the toilet, for example. So there's a lot of information in there. Unsuitable continence pads, if patients should be referred to the bladder and bowel service for a full assessment, and that helps patients then get the right pads for the amount of urine that's being voided, and not the size of the patient, it's how much urine is being voided. And so that's when also advice would be given about the right products that wouldn't interfere with the absorbency of the pad. So not rough, not drying the skin roughly, it's kind of gentle patting. So some general advice there to reduce the risk. And then how can we, or the carers, reduce the risk of developing? Again, it's about assessment, those regular checks of the skin, looking at a healthy diet and fluid intake, because that maintains healthy skin generally. And then how to refer, so the patient or the carer can directly refer to the bladder and bowel service, which is both clinic-based and there's a home base where that team would visit patients at home.
Yeah, I think that's like linked, isn't it, to the district nurses, but it's like the housebound continence team, so they would do the assessment. But if they're, obviously if they can go out, then there's clinics as well.
So I think it's over to you for any comments. Yeah, so I'm just seeing what's in the... Yeah, so we can share. We've got your email from when you registered, so that's just answering that earlier question. It's just if there's anything else, any thoughts, anything. Do you think it's useful? Is it targeting the right audience? Is it written in a language that you would be happy to, that you would understand, that you'd be happy to read? We don't want to overload with information leaflets.
Is it Donna? Oh, yeah. Donna, I could also share these resources with the local authority care agency.
Yeah, definitely.
Yeah,
that would be great. And that's
the other care agencies.
Yeah. And that's something that we're going to be looking at doing. It's once it's approved and ratified, it's then how are we going to distribute this information?
And then
so
that's the QR code with
and
that
the QR,
back on the back.
Thank you, Donna.
Yeah.
Sue.
I was just going to say, I think you were keen to kind of get any feedback, weren't you, in relation to, does the content feel right? Does it, we gave the health warning at the beginning about the pictures. How do they feel for people? Have they felt comfortable for people to look at, or those sorts of things? So I suppose it'd be good if there was any comments in relation to any of those bits, wouldn't there?
Erica, I think you've got your hand up.
Yeah,
Hi.
thanks for this presentation. I think the leaflet's really good. It was just one question I've got. Will you be doing this leaflet in different languages, or will it just be in English?
Yeah, it is available in different languages, and the link is on the very back page, which you actually saw on the first slide. I think it's five,
and I was wondering,
different languages.
Sorry, I was just wondering as well if I don't know if you'll be able to, but if you are doing them for like the BME community, if the the pictures, images,
yes,
if
yeah,
they could represent the skin tones as well, just a thought.
Yeah, it is something that we've thought about, and it's something that we can build into that. We just ran out of time, to be fair, which is why it was important that we certainly discussed it within the leaflet. And we are looking at building in, for all of our other training, we've got a range of different patient skin tones with different wounds, and we just hadn't quite nailed it in time for this one. But yeah, thank you for that. That's really
we've actually got to collect pictures that actually are. We've collected pictures of. We've actually got a skin tone group set up in CityCare, which I'm a member of, and that's for covering adults and children. And that question is now asked on everything that goes through CityCare's approval group, policies and guidelines approval group. And the problem we had with moisture associated skin damage is there aren't many pictures available. So we're aiming to collect pictures. We've got more pictures now of pressure damage, and there's more of those widely available on the internet in different photo sources. But moisture related skin damage, there just
Probably
isn't
don't
as
always
much.
get it, do you?
No.
Yeah.
So we will collect pictures with patients' consent to
Yeah.
use their photographs for teaching as well.
You've just got a comment in the chat that says that it's very important for the pictures to be presented. So
Yeah,
Good. Okay,
good.
that's great.
That's
Thank you.
good.
Thanks, Emma.
And then obviously, will the picture still work if the leaflet is printed and not in colour?
No.
No, so it
No,
needs to
it
be in
would need
colour.
to be, it would really
Yeah,
needs to be
they would
printed in
be
colour.
colour, wouldn't they?
Yeah, the ones that we will get printed will definitely be in colour. Oh, that was Emma's comment. Yeah.
Okay. Yeah, the other one was Mara. So
Yeah.
thank you for that.
Yeah. Thanks, Marwa, for that.
Anything else that anyone wants to say or make a comment on? Emma?
I was just going to follow up in my comment in the chat, because obviously if you're sharing it, you know, across different teams, that there's a high likelihood that it's going to be printed in black and white, not in colour. So maybe a bit of a caveat to, you know,
Yeah.
please do print these in
maybe to
colour,
put it. Yeah, that's true.
because otherwise it's going to get a little bit lost, isn't it?
Well, the images will certainly get a bit lost. People
Yeah.
wouldn't
Oh, yeah.
necessarily understand what they can see. I guess the information is there, but yeah, I think that's a really good point.
I guess if they use the QR code and shared it each other,
They'd see
then
it
they
in
would see it
colour.
in colour, but we could always put something, please ensure this is printed in colour to
Yeah. Yeah, good point.
present it. Mhm.
Lovely. If there's no further questions, we'll bring this to a close. I think we've got a slide that tells us when the next meeting is and what the subject matters are going to be. Have you got that, Sue? Just before we go. So
Yeah,
next
so that was on this. Yeah.
Lovely. Next share forum is Tuesday the 18th of June, 1:30 till 3. And topics already confirmed are breastfeeding advice for mothers returning to work. But I'm sure we'll have further topics to discuss with you. Can I just say thank you very much for listening. Thank you very much for attending and for all your comments and your participation. We really value this. We're really keen to make sure that we get real good patient engagement and views on anything that we're doing, so that you've got an opportunity to mould and shape what we're planning to do or presenting or thinking about. So thank you very much for your time. I look forward to seeing you on the 18th of June, and I won't take any more of your time today and allow the meeting to finish early, but thank you very much. Really appreciate it, and hopefully see you all soon.
Thank you.
And thank you to the speakers. Thank you very much.
Yeah, thank you.
Bye-bye.
Lovely. Thank you. And you've got a thank you for the comments from a member of the audience, so that's good. Take care and goodbye.
Thank you. Bye-bye.
Thank you. Yeah, some comments there, weren't there? Very much for him.
Right.